Hello, I'm Dr. Gonzalez, and today in this video we're going to talk about the following topics.
If we take a blood sample from a patient and we spin it in a centrifuge, we can separate that blood sample by content. For example, you will see 45 to 65% is going to be plasma, 1% or less is going to be white blood cells, and from 35 to 55% approximately it's going to be red blood cells. If we take a look at the plasma content is going to be 92% water, 7% is proteins, and 1% is other solutes. In terms of the proteins, some examples will be albumins, globulins, Fibrinogen, and other regulatory proteins. In terms of albumin, this is going to be a major contributor to osmotic pressure of plasma. Globulins are basically hormones or transporting lipids or working for some kind of immune function, like those that are released by the white blood cells. Fibrinogen is an essential component of clotting system, and it can be converted to insoluble fibrin. And other regulatory proteins include enzymes, proenzymes, or other hormones. In terms of other solutes, that 1% is going to be composed by electrolytes, other organic nutrients, such as those that are used for ATP production, growth, and cellular maintenance. So organic nutrients, and organic waste, such as those that are carried to sites for breakdown or excretion, and these include urea, uric acid, creatinine, bilirubin, and ammonium ions. Now, the other 56% is going to be the white blood cells and red blood cells. We call them form elements, even though this is not referring to the elements of the periodic table. Scientifically, we can call them form elements, and they form all the way from 37 to 54 or 55% of the total blood sample. So 99% of that percentage is going to be the red blood cells, also known as the erythrocytes. The other 1% or less, even all the way down to 0.1%, is going to be your white blood cells, also known as leukocytes. And for that, we have these different types of examples of leukocytes. For example, out of that percentage, the majority is going to be the neutrophils, which is going to be all the way from 50 to 70% of that entire sample. Eosinophils, 2 to 4% in total. Basophils, for example, it can be down to 1%. And then in terms of monocytes, which also transform themselves into macrophages, it's from 2 to 8%. And lymphocytes in general is 20 to 30%. And last but not least, I don't think I mentioned this before, but also approximately that other 0.1% is going to be platelets, which remember are there for blood clotting. So here's the information again. Remember that some of these leukocytes are also known as granulocytes, which means that they contain granules inside their cytoplasm. And then these others, for example, are considered agranulocytes, which means that they lack those granules.
Alright, now it's time for a short discussion break.
So some key facts about the red blood cells is that males have more red blood cells in average than females. As you can see, males have approximately 5.4 million cells per cubic millimeters versus females that have 4.8 million. In terms of the shape of these cells, they have a biconcave shape. These cells also lack organelles like the nucleus and the mitochondria, and therefore these cells cannot replicate themselves, right, during the process of mitosis. So they don't undergo mitosis, that's what I'm trying to say. And they lack mitochondria so that they don't take up that oxygen that they are transporting. Another important aspect is that they have hemoglobin, and I'm going to talk about hemoglobin in a second, but the lifespan of these cells is about 120 days. Remember that your blood cells are formed in the red bone marrow, right, inside your bones, and when after this lifespan is done, right, the 120 days approximately, they go into the spleen where they will be recycled or destroyed. In terms of hemoglobin, let's go back to that. Hemoglobin, basically the main purpose is to transport oxygen from the lungs into the tissues, and then carbon dioxide from the body tissues back to the lungs. So in terms of the red blood cells and hemoglobin, if you can see here, this is an example of a red blood cell right here. The red blood cell structure, like I said, it's a biconcave shape. So they kind of look like a donut, and they have that flexibility to bend, especially when they're passing through small capillaries. That's why they're this way, basically. In terms of hemoglobin, 95% of the contents of red blood cells is essentially hemoglobin. Thus, that's why they lack a lot of organelles. And if we look at actual hemoglobin inside the red blood cell, hemoglobin, it's made up of 2 alpha chains, as you can see here, and 2 beta chains. They also have each subunit containing a molecule of heme, thus hemoglobin. And this heme, if you look at it in each of these chains, if you take a look at heme contains an iron ion, because iron essentially is the one that binds to oxygen. The polypeptide units bind also carbon dioxide, but another fact is that oxygen and carbon dioxide do not compete with each other for binding sites. Regarding the information on blood types, don't forget to check out my previous video on my YouTube channel.
I hope this video has helped you, and if you like this shirt, it's now available on etsy.com/Queen Mary Anatomy. Thank you for watching, and see you next time.